If you are someone in your 40s or 50s and you want to rejuvenate your appearance, but you don't want to undergo surgery, you don't have the time, the inclination, the finances, for whatever reason, I have 4 good methods to rejuvenate your face. And I'm also going to discuss at the end of this video a procedure to definitely avoid. So listen up to the end. Before we talk about treatments and solutions to these age-related changes, what is happening with aging? And that's a very complicated question to address, but basically what's happening is we're having changes in our skin. The elastin and the collagen in our skin changes radically. We lose elasticity in our skin. We have muscle atrophy, there's fat atrophy, so there's volume loss in our face, and the bones in our face are actually rotating and changing, and our lips are lengthening in vertically. And we also have the gravitational effects of this laxity. As things become lax, they start to descend and become lax, and therefore the contour of the face changes. So the question is, how can we improve some of these changes, and can we do it without surgery? So the short answer is, none of these non-invasive procedures actually lift the face and lift things back to where they were originally. They will rejuvenate your appearance. They'll give you a fresher appearance, but they're not going to lift your face mechanically like a facelift can. However, many patients will benefit from these non-invasive procedures. So to begin with, I want to talk about something you probably all know about, which is Botox. Well, Botox, obviously, the way most of us have used it in the past is to inject this medicine into a muscle, namely right here between our eyebrows or crow's feet or up on our forehead. And in those cases, we're trying to inhibit the muscle contraction underneath the skin, which normally is transmitted to the skin and leads to wrinkles and folds. Okay, so we want to inhibit these wrinkles by injecting those muscles. However, Botox, it's been discovered, has other biochemical effects that are beneficial. So now I no longer am just injecting Botox deep within muscles to inhibit the muscles so that these lines diminish over time. I can improve the quality and tone and texture of the skin and the pores of the skin by doing what's called meso-Botox or micro-Botox. What that is using a dilute form of Botox. In other words, I use Botox, but I dilute it down and I put tiny injections right underneath the skin, or right in the dermal layer of the skin, not in the fatty layer of the skin or the muscle layer, deep to the skin, but right into the dermis, and I inject it 50 times on the face, on both sides, with little micro needles, which are called meso needles, and it goes down about 3 to 4 millimeters, and it causes a biochemical change in the skin that helps to rejuvenate the skin itself. How it does that, I can't even tell you. I don't know the mechanism, but we know it works well. And it works so well that you can really improve not only the skin texture and pore size of your face, but it can work on your neck and even on your chest skin as well. So some people have deep lines and folds in the neck or on their chest, and you can inject those areas. And those areas can be of cosmetic concern to some people who want to, for instance, wear a low cut dress, and they're concerned with the vertical lines around their breast. Meso-Botox can help that. Now, it may not work immediately. It may take more than one session to achieve the beneficial effects of this Meso-Botox. But if you do it repeatedly, you get a rejuvenation of your skin. Another thing I want to point out about Meso-Botox is that it has beneficial effects on people who have moderate acne, acne rosacea, pigment in their skin, and even scars. It can help soften some scars with repeated injections. So Botox has this biochemical effects that go way beyond just the paralysis of muscle and an inhibition of wrinkles on your face. The next category is facial fillers, and I'm sure most of you are aware of what facial fillers can do. Now, there's a lot of some controversy on whether or not facial fillers have negative effects over time. I believe that if you inject these fillers in a conservative manner, in a very strategic way, they can be very beneficial. And of course, there's virtually no downtime associated with them. So I think facial fillers still remain an important adjunct to non-invasive procedures. But there are other newer fillers, or relatively newer fillers, like Refine RH2, which are injected in a more superficial manner, and they can address superficial lines on your face, especially dynamic lines on the side of your face or on your neck, and that can be of great benefit. And there really are no other modalities that really can address those lines. So I do think fillers, again, do play a role. I don't think they should be trashed and thrown in the garbage. I think that they can be used wisely, but of course, anything can be used and mishandled and overused and create deformities that we don't really want. So I think it depends on who's injecting these fillers. I think the injector cannot be overly aggressive, cannot be overly enthusiastic and overzealous in terms of filling up large volumes on your face. I think then you start to get into problems that cause deformities and undesirable results. One area that I don't endorse for filling is the nose. I think there's people who are looking for non-invasive rhinoplasties, okay? Non-surgical rhinoplasties, where they're filling the dorsum of the nose or the tip of the nose. I think it's way too risky. I think these areas are filled with blood vessels, and those blood vessels can absorb some of the material that you inject, especially if they're injected with a sharp needle. They can embolize and cause necrosis of the nasal tip or even the forehead. And sometimes, believe it or not, the material can travel into a artery and go into your eye and blind you. So I don't believe that quote-unquote non-surgical rhinoplasty should be done. I think it's too dangerous. The third category I think is important to consider are these heat-based devices. And this is an area that really I have strong feelings about, because there are microneedling radiofrequency devices that, if are used again in a conservative manner, you can get improvement in the skin quality and tightening of the deep tissues. But if they're used in aggressive, high levels of power, and I don't like Morpheus 8. I don't like some of these other stronger devices, because I think that what they're doing is creating fat atrophy. The heat travels very deep into the tissues, way below the skin, and I think that is not beneficial to the patient. In the end, they're going to have atrophy of their face, their soft tissues, and they're going to end up looking gaunt. Either immediately or a year or 2 or 5 years down the road, and they're going to regret having these devices used on them. I do think, however, that a microneedling radiofrequency device can be of benefit to rejuvenate the skin and the deeper tissues, and I've seen that in my office. We do it in a conservative manner, and I think if you do it slowly over time, you can make improvements. Now, I can't attest to how many years that improvement will be sustained. I have to say I'm always skeptical about any of these devices. I approach them with, even if I own them, I have some skepticism on whether or not they work, and I constantly am checking to see, did it work, didn't it not work, and I've seen good results on patients, great results on some patients, and no results on some patients. So it really depends on the individual who you're treating. And the criteria for who's going to be a good candidate or bad candidate is not always very clearly delineated. So I do think they have a role, but I think that it's probably a limited role as well. Fourth category is lasers. Now, lasers come in very different sizes and shapes, so to speak. There are many lasers that can treat blood vessels, brown spots, and wrinkles. So each one of those lasers has a role to play in rejuvenating the face, depending upon what is presented at the time the patient is there. So you may have tiny capillaries on your nose or around your face, and then a pulse dye laser is certainly a very effective way to blanch those vessels. The pulse dye laser treatment, however, is not necessarily permanent. Those vessels may come back at some later point, but in terms of treating, the cosmetic improvement is significant, and it definitely has a role to play. Now, in terms of resurfacing lasers, there's carbon dioxide lasers and erbium lasers. And carbon dioxide lasers do treat deeper wrinkles, but the downside of that is it can cause hypopigmentation, sometimes even hyperpigmentation, meaning like the patient can react and become darker in color depending on what shade their skin starts with. You know, if they're a Fitzpatrick 5 or 6, these lasers are not ideal for them because the amount of heat delivered to the skin causes hyperpigmentation or sometimes hypopigmentation. So lasers do play a role because they can smooth out superficial lines and wrinkles, but they are not a panacea for everybody. But if they're used correctly in the right setting, they certainly are important tools. But I want to also point out the limitations where lasers do not work well, and that's generally on the neck or on the chest, because there's a sparsity of sebaceous glands which help regenerate skin in those areas. So if lasers are used aggressively on the neck or on the chest, they can cause scarring, hypopigmentation, and other problems. So I wouldn't go there with those lasers. Now, I have used fractionated lasers on the neck in a very conservative way, and I've gotten some improvement in the skin quality and texture. But I don't go very aggressively because I know the healing can be a problem after a laser treatment in those areas. Also, lasers are not great for acne. Okay, there's been a lot of recommendations from laser companies to treat acne with acne scars specifically with lasers. And in my hands, I've not seen great results with acne scars being treated with lasers because generally the lasers is smoothing out the surface of the skin, whereas acne scars are deeper and they go into the dermis, and you're only like cutting the tops of the mountain off, and you see the valleys below. So it really doesn't help with lasers in those scenarios. And another area where lasers are not effective is melasma. When you have this face of pregnancy, that some people call it, is where this broad pigmentation on the face. Lasers are not ideal for melasma because, again, it's delivering a lot of heat to the skin, and that only stimulates the melanocytes and it makes it worse. So lasers in general are not good for those areas. There are some picosecond lasers that are sometimes used for melasma, but in general, they have to be used ultra conservatively, and it's not a laser treated condition in general. Now you've heard 4 techniques to rejuvenate your face, which still have legitimacy despite what other plastic surgeons may have said. However, I want to emphasize that none of these procedures will lift your face. Mechanically lift your face. I think it's an overstatement. A lot of these non-invasive companies have kind of made claims that it'll help do a non-invasive facelift. I don't believe that. And neither can thread lifts. Okay, thread lifts really are just raising the skin. They really don't lift the deeper tissues of the face, which really elevate the face. They're only temporary, and they come with a lot of risk as well. I don't endorse thread lifts because I feel the benefits do not outweigh the risks. And it's only a short-term improvement, by the way, and it doesn't help with people who have significant laxity of their face because there's a wave of tissue that's pushed back towards the hairline and the ear, and therefore it really doesn't apply to people in their 40s and 50s. I hope you found this to be valuable. If you have any further questions, please leave them below, and we're going to continue to explore together other facial plastic surgery procedures.